Hey guys, here's my rodenticide and organophosphate presentation for May. Sorry it's taken so long. This is pretty much why I've been trying to get my voice over the presentation. I think it's pretty cool. Maybe I'll put it on YouTube, but probably not. But let's get started. It's really late at night, by the way, so I just want to get this done. So rodenticides, we all know what they are. Bait for mice and rats. They eat it, they scurry off, and they die. And they die because of anticoagulants. So what's happening is anticoagulants inactivate vitamin K, which is needed to produce clotting factors in the liver. So what this means is tissues will be weakened and spontaneous internal or external hemorrhaging can occur. And this can be from like a violent cough or a tiny little scratch or just time and weakening those vessels and letting the blood just gush wherever it may. So what's happening in the toxicity, vitamin K deficiency, it's not being created. Anemia, you have red blood cell loss with internal or external hemorrhaging. So you'll have a low PCV and TP count. Thrombocytopenia, which is low platelet count, so therefore no clotting. It all kind of makes sense. It's all related. And when you test for clotting, it's going to take a while because of that low platelet count and lack of clotting factors. So with your decreased red blood cell count, you're going to have hypoxia because you don't have a carrier for your oxygen. This will also result in bradycardia. Your heart's going to pump faster, trying to circulate those red blood cells that are in the circulation system. And then you can also get ascites or pleural effusion depending on where your internal hemorrhaging is happening. What it looks like when the client brings the patient to the hospital, they might have brought him because they're weak or unstable, probably a little anorexic too, depending on how long this toxicity has been going on for. Bruising, hematomas, petechia. We actually had a Shih Tzu not too long ago, maybe like a year ago, presented for inappetence and lethargy, and we saw this giant bruise on her belly, and the owner was like, what the heck, nothing happened to her, where'd that come from? And we asked about rodenticide, and he was like, yep, got decon in the garage, and he thinks she ate it about a week ago. So it took 7 days for that internal hemorrhaging to occur. The dog had a normal lifestyle, no trauma to her at all. There could also be blood in vomit, stool, or urine. Bleeding gums, if they're chewing on bones and scratch their gums, or their gums could just be sensitive and just start bleeding. Difficulty breathing, this would be because of hypoxia and lack of red blood cell count. And then they could have a tender or swollen abdomen, again, from ascites. So here's some pictures of what's going on. The top right lower left corner, dog barfed up some decon, and that's when you'd like to catch it as soon as they eat it, but in most cases, owners don't even think about it and won't see the dog eat the bait. In the bottom corner, you have ascites, so that whole abdomen is just filled with fluid. And then in the middle, pleural effusion, where the right side of that thorax is filled with fluid. And then here's an example of what we saw with that Shih Tzu. That stomach and that bruise looks like it got kicked when nothing happened. So that's internal hemorrhaging going on there. So how we treat this, dog's going to need to go to emergency and be hospitalized with overnight monitoring and all those goods. If the dog just ate the decon, induce vomiting, get the activated charcoal in the system to absorb any ingested toxins. With hospitalization, you'll get the IV catheter, fluids. The dog will get some vitamin K therapy to bring back that depleted vitamin K source, and this will continue after hospitalization. So they'll come back for vitamin K injections and to check those vitamin K levels. Because of the hypoxia, we'll need some fluid by O's to oxygenate. Plasma transfusions for the clotting factors and get those platelets back in the blood system. And then also some frequent PCV and clotting time checks. So That's what it takes. It may take up to a month for the patient to fully recover, and this is all time-based, so the longer it's been in the system, the longer it's going to take to recover. Pretty interesting. Now on to organophosphates. So what organophosphates do in the system is damage neurotransmitter production. Organophosphates are related to phosphoric acid. Doesn't sound pleasing. Don't eat it. It's found in pesticides, gardening soil, plant food. I read that they're making these things with less organophosphates, so that's good. And what this does, essentially, it harms the enzyme acetylcholinesterase. Boom, learned that word for you guys. And this causes severe muscle spasms, twitching, seizures, neurologic issues. So what's happening with the toxicity is we have hypotension and respiratory failure, and this is secondary to the neuropathy and central nerve damage. Bronchuria is another cool word I learned, and that's excessive discharge and fluid from the lungs. It can be watery or mucoid, and it usually results in a productive cough. So while the nervous system is being affected, organ systems aren't working the way that they should. So owner might bring in a dog with these symptoms here: muscle weakness and twitching, seizures, coma, the dog just fell over and is not getting back up, difficulty breathing, and that could be with the respiratory failure, the bronchuria, even hypertension. Meiosis is where you have two different sizes of your pupils, also neurologic. Hypersalivation, and then the case study I read, there was some abnormal frequency in defecation and urination, like the dog didn't have control over it and it was just kind of spitting out as it will. So pretty crazy. And we actually had a case today, Troy Butterball, who presented with a lot of muscle twitching and seizures. So not sure if it was organophosphate poisoning, but after reading this, might be. Here's some pictures. We got some meiosis going on in the top left corner, that tiny ass pupil and that big ass pupil. Hypersalivation, and then the seizing dog. We've all seen that. Pretty scary. Dog's non-responsive. It's arching its back, extending its limbs and its neck and its head, and it doesn't look like it's comfortable. So here's how we treat. Dog will need to be hospitalized. So again, an emergency hospital with overnight care, IV catheter, blood work. Want to make sure that there's no organ failure going on with this central nervous problem. Radiographs for pneumonia, as fluid will build up with that bronchuria, and you want to catch it sooner rather than later. And then there's lots of medications that will treat for the symptoms being presented. In the case study I read, methocarbamol was given as a CRI for muscle relaxation, and it helped with the twitching. Oh, sorry guys, it wasn't a CRI. I think she said every 8 hours. Today we gave Troy Butterball diazepam for his seizures. I didn't read that in the case study, but I would assume you would treat seizures as needed. You'd also want to give analgesics for pain. They're contorting, they're having muscle spasms, doesn't feel good, want them comfy, relaxed. GI meds, the metoclopramide was given as a CRI, and that's for gut motility. With the case study, they weren't sure, he was defecating spontaneously, but they weren't sure if the system was moving correctly. So that helps move things along. And then they also sent it home along with famotidine and sucralfate, and that's for any acid that's sitting in the GI tract, so you don't want to harm those tissues. They gave atropine IV for the neurologic symptoms presented, so it resolved the meiosis, it resolved the hypersalivation, and I'm pretty sure also resolved the spontaneous defecation. And then pralidoxime, I think it's pralidoxime, sorry. This cool drug is treats nerve agent poisoning, and in the case study, they gave it when it was confirmed that the dog ingested organophosphate. So, not sure if you would give it regardless of knowing the cause, but if you saw the symptoms, I'm not sure when you make that judgment call, but they didn't give it until it was confirmed. So, pretty crazy stuff, and definitely want to know if they tested positive for organophosphates. I don't know how you test for organophosphates. But Troy Butterball, I want to see if he had that in his system. So I'll be sure to ask me or follow his clipboard. One thing that they said in the case study, that death can occur. It would be from secondary respiratory failure. So pretty scary stuff. Definitely want to treat it, or death can occur. Well, thank you guys so much. Like I said, it's late. Sorry for stumbling over my words. And please enjoy this awesome GIF. So funny. Nighty night, guys.